Welcome to this episode of Disease Du Jour on the topic of forelimb rehabilitation tips in horses with Dr. Steve Adair of the University of Tennessee. I'm your host, Kim Brown, publisher of Equine Management. The Disease Du Jour podcast is brought to you in 2021 by Merck Animal Health. Dr. Adair is a diplomate in the American College of Veterinary Surgeons and the American College of Veterinary Sports Medicine and Rehabilitation. He is certified by the American Veterinary Chiropractic Association in animal chiropractic and is a certified equine rehabilitation practitioner. His special interests are in equine rehabilitation, lameness, and regenerative medicine. His clinical focus areas include equine lameness, rehabilitation, and orthopedic surgery. Dr. Adair holds a bachelor's degree in microbiology, a master's degree in veterinary microbiology, and received his DVM from Auburn University. Thank you, Dr. Adair, for joining us today on Disease Du Jour to talk about forelimb rehab tips in horses.
Thank you, Kimberly. I appreciate it. Glad to be here. Beautiful day in Knoxville, Tennessee after the rain. It's blue skies and supposed to be in lower 60s today. So oddly enough, we've got good weather for a day or two.
Well, that's good. And I got to tell our listeners, because I know you can't see Dr. Adair, but he is wearing Tennessee orange. I just want you to know that.
I do have my orange gaiter on. We, as with everybody, the school, we wear masks all day long, except if you're in your office. And so certainly would encourage mask use wherever appropriate.
Well, that's good advice. And we're going to go with you for some other good advice today, because we know equine rehabilitation has come so far from the days of when I remember of pin firing and mustard plasters, and the solution to everything was stall rest. So what do you recommend that veterinarians focus on to improve their rehabilitation skills for the equine forelimb? And I think you wanted to start with diagnostics.
Yeah, I do. I think in order to provide a appropriate and beneficial rehab plan, that having an accurate diagnosis is going to be of paramount importance. Certainly, if you don't have an accurate diagnosis, how do you know what to do? So oftentimes, we're also providing treatment at the same time we're doing rehab. And I think that's important. Rehab doesn't start 2 weeks after your diagnosis or 3 weeks. Rehab starts immediately. And we actually do what we call Prehab here, in that we do exercises and, quote, rehabilitation before we do surgery or something like that. So, and I think you'll recognize that in the human medicine, that they do prehabilitation. They have you start doing exercises prior to joint replacement surgery. And then just as soon as your surgery is complete, physical therapist is already coming in and starting to do things either that same day of surgery or at the latest the next day. So, like I said, the rehabilitation starts, like I said, prior to surgical intervention or as soon as possible following intervention or any type of injury. So you need to know where that problem lies. And so doing accurate diagnosis and accurate localization within the limb is very important, and coming back and trying to ascertain the degree of damage that's going on, either radiographically, ultrasonographically, MRI, CT, whatever the case may be. And the reason that's important is during the rehabilitation process, you want to know whether you're actually helping or not. You need to develop some type of of therapeutic monitoring in order to determine how this case is progressing or hopefully not digressing. And so, you may want to come back and reshoot radiographs. You may want to do frequent ultrasonographic evaluation. You may want to do frequent gait evaluations. And so all of those things are going to be important. And unless you have the nature of the injury or the condition fully investigated, you're going to have a hard time. And that leads into therapy. Having an accurate diagnosis will allow you to select the most appropriate therapy for the condition. And then once you've got all of that together, then I think that's when you develop your rehab plan. And I think it's important to recognize, especially with rehabilitation, it's a team approach. It's not just the veterinarian. Certainly the veterinarian is going to be very important, but then you've got the horse owner, you've got the trainer, you may have a massage therapist, you may have the dental technician, you got the farrier. Everybody needs to be on the same page, and having the veterinarian able to elucidate and talk about the injury, the severity of the injury, the prognosis, et cetera, it's going to be important. And like I said, all of that comes back to having an accurate diagnosis in order to determine the most effective treatment and the most effective rehabilitation plan.
Okay, well, that sets a good groundwork then. I didn't know about the prehab. I mean, I do in humans, but I didn't really, like I said, equine rehabilitation has just come so far.
Yeah, there's a lot that we can do up to let's say a surgery. The prehab's going to be primarily if you're doing surgery. So let's say that I'm doing tenoscopy on the deep digital flexor down within the tendon sheath. I may want to, prior to surgery, start doing some weight shifting exercises, maybe some stretching if they're amenable to it. I may want to go ahead and institute therapeutic trimming and shoeing. All of that would be considered prior to the actual surgical intervention itself. And then once you do surgery, coming in and doing pain control and doing some of these weight shifting exercises, et cetera, is going to be extremely important. It's interesting. It's no longer, and I'm a surgeon, and my whole thing used to be 30 days in a stall, 30 days in a paddock, and 30 days kicked out to pasture. And probably about 15, 20 years ago, I recognized that there had to be more to it than that. And so my adage is, rehab is more than stall rest, and I think we recognize nowadays that immobilization is not our friend, and that's why I mentioned humans following joint replacement surgery. I mean, they have you up the same day moving because they recognize that inactivity is not good, and so what we're doing is trying to encourage movement based on the diagnosis and based on the treatment, and that wraps all the way back around to having an accurate diagnosis to start with. There's many ways the rehab is improving continuously. Now, we look at, let's say, superficial flexor tendonitis. People were really, really concerned about horses overloading a bowed tendon. And now we've got really nice articulated braces that can protect the flexor apparatus. And when you do that, it allows you to institute loading of the leg in a controlled situation much, much, much earlier than any other time before. And we know tendons and ligaments remodel along the lines of stresses. And so if you can do a controlled exercise program with them and a controlled loading regime with your tendon and ligament injuries, you can get a better quality product. Okay. Now, it's not necessarily about trying to shorten up the overall healing period, but what you're trying to do is improve the quality of the healed tissue. And that goes for any of the tissues. Rehab, yes, it may be able to shorten the overall back to work period, but by a little bit. But really, that should not be a goal of rehab. A goal, what rehab is trying to return the individual to some type of constructive life following injury. And for the most part, when we're talking about rehab, we're talking about injuries and or surgeries to the musculoskeletal system. There's all different kinds. People will also consider rehab of abused and neglected horses and starved horses, etc., which is fine. But in what I usually do, my stuff is dealing with rehabilitation of injuries, or at least some kind of chronic lameness condition per se. So we've got a lot of different options depending on what the injury is, and you can start, down at the foot and work your way all the way up and address each disease process individually. But, for the most part, what you're going to be dealing with is, what do you do for bone and joints? What do you do for tendons and ligaments? And what do you do for muscle? And that basically is it, regardless of the location on the limb. So it's let's face it, if you're looking at the foot, you've got tendons and ligaments and bone and everything down in the foot, so you'll address those situations just as you would be a injury to the forelimb or shoulder or higher. And so those things are going to be important. So if we talk about those type of problems, and let's just start with the bone. What are some rehab things that you can do for bone? Okay. Certainly, it's going to depend on the nature of the injury and what the actual condition is. But certainly, I'll get back to the loading. Wolff's Law, bones remodel along the lines of stress. And so you're going to want to try to do a gradual increase in stress on the bone. And that may start out with nothing more than in a stall, using balance pads and doing asymmetrical loading back and forth. Basically you just do weight shifting, and that may be it. if you've got a fracture that you've plated and that you're dealing with, uh, you may not certainly want this individual walking up and down the hall. And so it may be nothing more than than going in and doing weight shifting exercises. Another thing that is certainly beneficial is stretches. You can take a fairly inactive horse and you can still do baited stretches while they're in the stall, regardless of what the problem is. Okay. After that, in the initial, if you've done surgery or if you've got acute inflammation, what are we going to use for that? Cold. That's everybody thinks, oh, I need to use all these gadgets and everything, but bottom line is cold is probably still the most efficacious modality out there to decrease pain and decrease inflammation. And so certainly where appropriate, cold application several times a day is extremely important. And you can do that on your post-operative conditions. So you just need to take appropriate care so the suture line doesn't get wet. Yeah. But you can apply cold. There's no reason not to. As far as that goes. You can also use laser for anti-inflammatory. Okay, I like it. It does. I think in the face of acute inflammation, I think the therapeutic laser does a good job, regardless of the tissue. Now we do have to question what the depth of penetration is, and can you adequately get the enough photons down to the level, the target tissue. I mean, certainly that is an appropriate concern, and we could spend an hour or 2 hours talking about that. But certainly, I do like it. I do think it's beneficial for that. Moving on to other things that can be done with bone, I do think we need to recognize that a lot of the modalities that are available to the veterinarian or to the rehab market, we can demonstrate effect on tissues, but we don't know whether they're efficacious or not. We don't know whether they change the course of the disease process. Okay, there's just not anything out there, at least in the horse. Now, there may be something in other species, okay, but in the horse, research dealing with efficacy is very limited. And so oftentimes we extrapolate over from other species, which may or may not be appropriate, okay. I can give you an example of some research that I did and one of my residents did a few years back, is that in humans and in dogs, we know therapeutic ultrasound will increase the temperature of muscle. Doesn't work that way in horses. We were not able to demonstrate elevation of temperature into a therapeutic level. Now we can raise it a little bit, but it just doesn't get to the level that we deem as necessary to achieve a therapeutic effect. So it works in humans and dogs, but it doesn't work in horses. So extrapolating that from humans and dogs to horses is not appropriate. Now we can heat tendons and ligaments up, no doubt. We showed that. But horses' muscles are a little bit different than dogs and humans. So that's just an example. But getting back to other interventions on bone, if you're looking at bone healing, probably shockwave therapy is one. Now, you're not going to necessarily use shockwave in the face of bone plates, but certainly, or any type of internal fixation, but certainly shockwave therapy has been shown to improve bone healing. So it can be used during the rehab period to accelerate or to speed up or to kickstart a slow healing fracture or what have you. I had hoped that whole body vibration would be something that would be beneficial for bone density. Unfortunately, the research has not shown that to be the case with horses. In humans, we do know that whole body vibration can improve bone density, primarily in women that have estrogen-induced osteoporosis. The kicker on that, though, is that you have to go on it twice a day for 15 or 20 minutes, and it takes several months before you notice an effect. My hopes, we do know that horses, if they stand in a stall inactive, after 28 days, they start to lose bone density. So I had hoped that whole body vibration could be used in order trying to prevent that decrease in bone density. But unfortunately, that hadn't panned out as of right now. Now, it may be related to equipment. It may be related to the wave of the vibration and the frequency and etc. But again, we have not been able to establish proper technique for whole body vibration. After that, there's really probably only one other modality that may have some benefit, but certainly hadn't been shown or proven in horses, and that's pulsed electromagnetic therapy. And that has certainly in humans has been shown to improve bone healing, but all the studies thus far that have been done in the horse have not been able to document any type of benefit. So, but I mean, it is an option. It certainly is an option. Speaking of pulsed electromagnetic, there's a couple of different, there's a high intensity, and then there is what is called a targeted pulse electromagnetic. And the targeted pulse electromagnetic is a low intensity apparatus, loop is what we call them, that have been shown to decrease the need for analgesics in the postoperative period. It's been shown in humans and in dogs. Currently, we haven't been able to fully elucidate that in the horse. So I think work it needs to be done in that area, looking at the ability of these targeted pulse electromagnetic apparatuses to actually improve postoperative pain or decrease postoperative pain. Okay. Kind of moving on for joints, moving from bone to joints. I think the biggest thing that we're going to find with joints that we can do for rehabilitation is motion. Okay. And, if you think about it, cartilage is avascular. And how does it get its nutrition? How do the chondrocytes get their nutrition? And it's basically from the cartilage kind of acts like a sponge. And when you weight bear, waste products go out of the cartilage. And when you non-weight bear, then it sucks nutrients in from the synovial fluid. So again, we get to loading and unloading of joints within the stall. So asymmetrical loading of joints, balance pads, if they can't be fully worked. We do know that certainly underwater treadmill can be utilized to not only help with joint motion and such, it can also be used to decrease the weight being borne on the limb. So if you've got, so the buoyancy effect that's there, so you can get motion and decreased weight bearing on the joints. So that can certainly help with cartilage nutrition. We know that we can use underwater treadmill to increase the range of joint motion depending on the depth of the water. And so you can use underwater treadmill as a target to target specific joints by using the water depth. And then after that, we can start doing passive mobilizations of the joints by simply flexing and extending joints or something very easy to do. Also, taking a horse and if they're capable of being walked, taking them and walking them over ground poles in different heights of cavalettes and things like that. All of those things can be utilized in order to improve range of joint motion.
Today's Disease Du Jour podcast is brought to you by Merck Animal Health, the makers of prestige vaccines, Banamine, Panacur, Regenerative, Protozil, and other trusted equine health solutions. Merck Animal Health works for you and for horses. Learn more about Merck Animal Health's comprehensive portfolio of products, as well as their ongoing investment in our industry, profession, and community at mercanimalhealthusa.com.
The other thing I like to do with joints is that if I'm able to, is to prior to exercise, is to heat the fibrous joint capsule up. And what that does is if you've got some restrictive scar formation within the joint capsule, that is decreasing joint motion, I'll often do therapeutic ultrasound over the joint capsule prior to doing stretching. I think it makes the joint capsule more pliable, more stretchy, and by doing that, I think it makes your passive mobilizations and your stretches, what have you, I think it makes them more effective. So certainly that's an option as far as that goes. Additionally, if the joint is very painful to manipulation, then you're going to want to do some type of pain control prior to doing manipulation. So yeah, you may put cold on it initially if there's pain involved, or you may use a laser trying to decrease inflammation and pain prior to movement. And so those are certainly things that are can be indicated or can be used. If you're dealing with injuries of the fetlock to where you have issues with extension and flexion, and let's say you want to limit the extension, then certainly using articulated braces can be used. There's one or two on the market that are used to decrease the extension of the fetlock and thus protect the flexor apparatus. And so using something like that, let's say you're dealing with sesamoid fractures or a condylar fracture or something like that, and you don't have an underwater treadmill, but yet you want to exercise this horse, but yet limit the loading of the fetlock. Certainly these articulated braces can be of benefit from there. After that, like I said, the biggest thing I think that you're going to find with your joint injuries is that the last thing you want to do, or if you can get by without it, is immobilization. And trying to avoid immobilization is important. And if you have to immobilize, then you should immobilize for the shortest period of time as possible. So, I think that's about it on bone. After that, I think looking at tendons and ligaments are going to be another area, in the limb that we look at. Certainly, superficial flexor tendon, deep digital flexor tendon, suspensory ligament injuries, both high and mid body and low, distal sesamoidian ligament injuries, collateral ligament injuries. All of those type of injuries are important, and it's something we deal with on a regular basis. Again, there's a term out there that's called regenerative rehabilitation, and that's the combination of using regenerative medicine and rehabilitation simultaneously. So what we actually do here is we do a lot of that. We use a lot of regenerative medicines in combination with rehab, primarily for our soft tissue injuries. Some joints, not that much bone, but primarily our tendons and ligaments are our primary regenerative therapies are going to be directed at. So it's not uncommon during the rehabilitation period for us to be utilizing stem cell injections or platelet-rich plasma injections, etc. And then we'll combine. We'll do some rehab modalities along with them, such as with PRP. We know that utilization of shockwave increases the release of growth factors from platelet-rich plasma. So we'll actually do shockwave therapy after we do a PRP injection. We know low-level laser therapy and hyperbaric oxygens and radiofrequency therapy can all have a stimulatory effect on stem cells. And so utilization of those different modalities around the time of stem cell injection certainly can be beneficial. Hyperbarics, we know that you can increase the level of circulating stem cells by threefold at least. And so pre-treating a bowed tendon with hyperbarics prior to stem cell injections may actually increase the migration of the body's own stem cells into the lesion, because we kind of know that those stem cells that you inject into the lesion, they kind of they're more attractants. They kind of have a chemoattractant type of thing, recruiting the body's stem cells to come into the area. So, pre-treatment and during and then post-treatment injections with hyperbaric certainly can be a benefit. Laser, certainly we know that at least in vitro, that low-level laser therapy stimulates stem cells, the mitochondria. So that's certainly something can be used around the time of stem cell injections. Plus, it does have an anti-inflammatory effect. So if you do get some type of inflammatory reaction to your injection, if you're doing low-level laser therapy, it may reduce the need it may reduce the inflammatory reaction that you get post-injection. You can also use cold, same thing. We try not to use non-steroidal anti-inflammatories around the time of stem cell injections, because we do know that there are certainly some NSAIDs that can interfere with stem cells. And so we try to avoid those if we can. Along that lines, we also know that NSAIDs can interfere with bone healing. So that's another area where rehab and trying to control pain and improve mobilization may decrease the need for NSAIDs. Again, it's very similar to bone. We know for a fact that tendons and ligaments remodel along the lines of stresses. And so by instituting early loading of your tendons and ligaments, certainly can aid in the, you get a better quality healing. You don't have this hodgepodge of a mesh network of tendon fibers or ligament fibers. You've got nice parallel rows, and which is going to be a much higher quality product. It's going to be much less prone to injury. So again, I get back to early loading of these tendons. If it's involving, or ligaments, if it's involving the flexor apparatus, then I'm using articulated braces. If it is like a collateral ligament or something like that, and you have to have the horse on some type of deformable surface to walk on, then we're using asymmetrical shoes during the rehab process to try to stabilize the foot landing and the load that's being transmitted down the limb. So there's many different ways of doing that and loading it up. Certainly the underwater treadmill is something to do because you can decrease the weight bearing or the ground force reaction on the tendons and ligaments in the underwater treadmill. And I've actually even taken horses with severe tendon injuries and put the articulated braces on them and put them in the underwater treadmill. So you can do combination therapies like that very easily. I think one thing we need to recognize during the entire rehab process is that the old adage, no pain, no gain. So I do think you need to recognize that during the rehab process, you may get periods to where there is some acute inflammation. So I tend to break the rehab period down into acute and chronic, just for simplicity's sake. And to me, acute is when you've got active inflammation going on. Chronic is when the inflammation's resolved, and what you're doing then is trying to improve blood flow to the area. You're trying to remodel scar tissue. You're trying to strengthen tissue, improve endurance, etc. However, during that chronic period, we need to recognize we're going to have periods of inflammation. Let's say you've got a bowed tendon and you take them out and you push their exercise a little too much and you get a little heat and swelling in that tendon. Well, yes, you're in the chronic period, but you do have some active inflammation going on. So you back up and you back down on your exercise intensity a little bit. You apply laser and cold. And as soon as that inflammation is subsided, then you progress them back up. And that's where frequent evaluations of your patient is important. You shouldn't just prescribe a rehab program for the owner to do and then come back 3 months later and look at the horse. They need to be you need to do frequent evaluation so you can adjust your rehab plan. And then that's especially important when you're dealing with injuries. And along that lines, I do think it's important to recognize with, let's say, underwater treadmill. The underwater treadmill, you can condition a horse and they can be feeling really, really good, but the injury has not caught up with how good they feel. And so, some of these horses, and you've got to be a little bit careful, is that the injury may not be healed enough to withstand whatever stress that horse is going to put on it because they feel so good. So you've got to, by doing frequent reevaluations, that will allow you to judge how much exercise that you can do. And you just need to be flexible, and adjust your plans fairly frequently. Maybe not weekly, but certainly bi-weekly or at least monthly. At the absolute minimum. I mean, horses here in our rehab facility, we do weekly evaluation. Well, we do daily evaluations, to be honest with you. But for full evaluation, gait evaluation, lameness evaluation, etc., we do it weekly because we want to be able to adjust our program based on what the patient itself is doing. Moving away from tendons and ligaments, moving up to muscles. Again, you're talking about strengthening muscles and maintaining some type of condition. And I'll give you a prime example of a case that's a muscle involvement is suprascapular nerve paralysis, Sweeney. We know that a lot of these horses that have suprascapular nerve injuries, within 75 to 90 days, they will regain nerve function. The problem being is during that period of time, the supraspinatus, infraspinatus have undergone atrophy, and those muscle fibers are being replaced with scar tissue or fibrous tissue. So we know for a fact that you can do e-stim, electrical neuromuscular stimulation of your infraspinatus, supraspinatus, and you can maintain muscle fibers. And so to me, it just makes sense that I know a horse I diagnosed with Sweeney, then I'm going to start a neuromuscular stimulation program. And I'm going to let the owner do it at home. To be honest with you, I'm going to prescribe it. I'm going to show them how to do it. I might even sell them the e-stim unit. And then I'm going to go back out monthly and just check it. Because what's going to happen is once that nerve regains function and you've got more normal muscle remaining, then you're going to have a better end product. That shoulder is going to be much more stable. And so that's just an example of maintaining muscle mass. And the same thing goes along with muscles in any of your injuries, regardless of whether it's a bone, a tendon, a joint, or muscle. Inactivity again is going not to be our friend. And so same thing with muscles. If you can do weight shiftings and do isometric contractions and relaxations and contraction and relaxations, all of that is going to help your patient in the long run. So then after that, once you've taken the horse through a rehab process, at some point in time, you got to get back on the horse. The horse is going to have to go back to doing something. And so that is where, depending on the use of the horse, maybe they only want a pasture pet, and that's fine. But if you want a riding individual, then at some point in time, you're going to have to start a back to work program. And so I utilize my rechecks in order to determine when is it going to be appropriate to start increasing the intensity or the type of exercise. And then at that point in time, I usually start with tack walking, and they may still be in a stall with hand walking only, but I'll institute tack walking, and I'll start it with 30 minutes a day. And then the next week I'll do 35 minutes a day. And then the next week I may do 45 minutes a day. And then I'll reevaluate. And if they're doing good, well, maybe I'll start adding some trot sets in. And so I do graduated increases in my trot sets over a month, and then reevaluate. And if they're doing good, then I may start adding some canter sets in. So my back to work program is about 3 months, and that's after I've already done some degree of rehab on them. So, I may be 90 days post injury, and then I'm got another 90 days that I'm putting in for back to work. So I'm 180 days post injuries. That would not be an uncommon scenario. I mean, it certainly is a possibility. So all of this requires, again, it's a team effort. I do try to teach the owner to do things, because, to be honest with you, they can't afford to have me do everything. So I try to come up with some simple stuff. And we don't. And one thing I want to press upon people is therapeutic exercise is a big area. If you go to a human physical therapist, they're really not that modality driven. They're more exercise driven. So they're gonna have you exercising and doing joint motions and loading and unloading before they're going to pull out a laser or an E-stim unit or something like that. So it just takes a little imagination. It doesn't take a lot of money. You can, for proprioception, walking over a bunch of different zigzag poles can help. Different surfaces. You can take a horse and walk them from concrete to gravel to synthetic footing to grass to water, and all of those, each one of those situations changes proprioceptive input. You can put little ankle weights and bracelets on them and get them to increase their range of joint motion. As such, that's something very easy to do. You can take these TheraBands and wrap them around the leg and just hold it and make the horse, have somebody hold it to the side and then walk the horse sideways and make them abduct and adduct the limb. So it's kind of hard to talk about that and not visually show you how to do it, but it takes imagination, and it's pretty easy to do. And for reevaluations, I mean, we all have phones, cell phones, and you can video the horse and slow it down and look at range of joint motion. You can look at length of stride, etc. You can take a tape measure and measure limb circumference. Certainly the ultrasound for looking at tendons and ligaments. And if you don't have a phone, you don't have anything else, take a rake and rake out a smooth spot in the sand and simply walk the horse in the sand and look at how long the stride is, and take, you can evaluate that. So you don't have to have a lot of sophisticated equipment. So I think I've covered a lot.
You have.
I've been just sitting here babbling on.
No, this has been wonderful, because I have become so intrigued by the advances in equine rehabilitation just in the last few years when I've been really following it.
Sure.
And I love the fact that you have given veterinarians and techs a way to, from the very basic, hey, hold still works. And if you don't have all this equipment, you can use some other things, all the way up to here's what's possible.
Yeah.
And the ways to use it. So I think this has been wonderful. So
good.
I could have listened for another session. So we may have to get back together and talk about maybe a different limb or other sections of the body, because I know backs and hips. And,
yeah, there's all different things. I mean, we got a whole program we do for neurological horses, EPM horses, et cetera, as far as improving proprioception, improving core stability. And that's one thing I didn't address. And let me say something a little bit is, regardless of the injury, core muscle development is important. Okay. So it really doesn't matter. So you can start that in the stall. You can do butt tucks and sternal lifts. All of those things will activate the core muscles, and you can do that. And this horse may have a bowed tendon, but it still needs core muscle activation. There are ways with TheraBands and Equicores and Pessoas that once they're able to ambulate sufficiently, you can use those to improve core muscle. Underwater treadmill improves core muscle and postural stability. So all of those work together. And so regardless of the injury. So, and lastly, the one other thing we shouldn't neglect, and again, this is a global thing, or two things. One is the mental status of the horse. So you need to address boredom, stall boredom, etc. And it may be getting them a buddy and putting in the stall with them, a goat or a pony or something like that, having toys, getting in the stall and working with these individuals multiple times a day. Nutrition is important. If you've got an injury or a disease condition, you've got to have an adequate plane of nutrition in order to heal. And so you want to evaluate that individual's nutrition and feeding regime, and making sure they've got enough, or they don't have too much. I mean, let's face it, individuals don't necessarily need a lot of calories when they're not doing a lot of work. And so you may just have them on a good quality grass hay and a ration balancer and a salt block and fresh water. And then we like to use omega fatty acids here for anti-inflammatory. So we put them on that. We also, all of our horses, we feed their hay out of slow feeders, nibble nets, nag bags, whatever you want to call them. Because horses get bored. They're meant to be continuous browsers. And if you throw a flake of hay in there and they eat everything in 30 minutes and you don't throw another one in for 8 hours, what are they going to be doing during that 8 hours? So, having slow feeders, plus it stimulates production of bicarb, and thus it helps buffer the stomach acids. And so it can help decrease the incidence of gastric ulcers. So, you don't need to tunnel vision down onto the injury itself and neglect the rest of the patient from both a mental standpoint and a nutritional standpoint is very important.
That's so important to bring that up.
Sure.
Well, thank you so much, Dr. Adair.
You're welcome.
I have enjoyed this so much. And we want to thank our audience for listening to this Disease Du Jour episode, and special thanks to our 2021 sponsor, Merck Animal Health. So we'd like to ask our listeners to please rate previous and future episodes of Disease Du Jour on iTunes, SoundCloud, or Stitcher, or your favorite podcast platform. Make sure and take our Disease Du Jour survey so we know which topics you want to hear from us. And if you have any questions or suggestions, you can send me an email to kbrown@aimmedia.com. Disease Du Jour is a production of the Equine Podcast Network, an entity of the Equine Network, LLC. And we're done. Oh, I enjoyed that so much. When you and I started in this industry, and I started in thoroughbreds in Kentucky, and if you had said, "Hey, we're going to do some core exercises on this thoroughbred," everybody would have looked at you like you've been drinking too much bourbon.
Yep.
So I love this.
Yeah, it is, and it's gonna be doing. We're doing a lot of research right now, looking at muscle activations. And what exercises activate different muscles, what muscles are strengthened by certain ones. How does what muscles do balance pads activate? What muscles are activated by the core devices such as psoas, et cetera. So, I think you'll see more and more research coming out dealing with rehab. So
I think it's great, and I can't wait to hear more. So
cool.
Thank you so much.
You're more than welcome. Thank you.
Because I love this topic. So
all right.
Thank you, Dr. Adair.
You're welcome. Have a good one.
Bye-bye.
Bye-bye.